Welcome to Antibiotic Stewardship in Long-Term Care Facilities. This presentation has been made possible through a grant from the Centers for Disease Control and Prevention. The following slide set will introduce the concept of antibiotic resistance and why it is critical for healthcare facilities to implement strategies to control the use of antibiotics. Antibiotics are among the most commonly prescribed drugs and can be life-saving. They are drugs that kill bacteria and are completely ineffective against illness caused by viruses. However, up to 50% of the time, antibiotics are not prescribed properly, resulting in people taking them when not needed, such as for a virus, or they are given the incorrect dosage or duration. Many medical advances, such as surgery, organ transplant, and chemotherapy, rely on antibiotics to treat common infectious complications. Without effective antibiotics, we will quickly return to a pre-antibiotic era where infectious diseases are a major cause of death. Antibiotic resistance is the ability of bacteria to resist the effects of an antibiotic. Here in this image, you can see how antibiotic resistance occurs. First, during an infection, there are lots of germs, and a few, depicted in red, are resistant to drugs. When a patient starts taking antibiotics to kill the bacteria that are causing the illness, the body's good bacteria, which protect us from infections, are also killed. When the body's good bacteria are killed, the drug-resistant bacteria are able to grow and multiply. The problem continues further because some bacteria have the ability to give their drug resistance genes to other bacteria, which creates even more drug resistance. Antibiotic resistance has a significant impact on the United States healthcare system, being responsible for more than 2 million illnesses and 23,000 deaths each year. In 2015, the White House released a comprehensive national action plan for combating antibiotic-resistant bacteria. The action plan will require sustained, coordinated, and complementary efforts of individuals and groups around the world, including public and private sector partners, healthcare providers, healthcare leaders, veterinarians, agricultural industry leaders, manufacturers, policymakers, and patients. Efforts carried out as part of the action plan will help the federal government curb the rise of antibiotic-resistant bacteria with the goal of saving lives. Antibiotic resistance certainly affects individual people and society as a whole. However, antibiotic resistance is a worldwide problem, not just an issue in the United States. Over the past several decades, antibiotic resistance has increased and spread dramatically throughout the world. In the European Union, antibiotic resistance causes 25,000 deaths per year and 2.5 million extra hospital days. In India, over 58,000 babies died in 1 year as a result of infection with resistant bacteria, usually passed on from their mothers. In Thailand, antibiotic resistance causes 38,000 deaths per year and 3.2 million hospital days. The resistant bacteria can spread from person to person and over the course of time can become widespread around the globe. According to a past director of the CDC, antimicrobial resistance is one of our most serious health threats. Infections from resistant bacteria now are too common, and some pathogens have even become resistant to multiple types of antibiotics. The loss of effective antibiotics will undermine our ability to fight infectious diseases. Long-term care settings, such as nursing homes, present a set of unique challenges in the treatment of bacterial illnesses. Approximately 15,000 long-term care facilities in the United States provide care to an estimated 1.7 million people. They serve patients whose often complex medical needs leave them susceptible to a variety of illnesses. Infection rates among long-term care residents nationwide are estimated to be as high as 12%, with pneumonia and urinary tract infections being the most common. Up to 70% of residents in a nursing home receive antibiotics over the course of a year, and studies have shown that up to 75% of antibiotics prescribed in nursing homes may be unnecessary or inappropriate. Ultimately, appropriate antibiotic use is a patient safety issue because antibiotic use comes with potential harms. Patients can experience negative effects from antibiotics, including serious diarrheal infections such as Clostridium difficile, adverse drug reactions or interactions, and colonization or infection with antibiotic-resistant organisms. Frail and elderly patients are at the greatest risk. So if antibiotic resistance is a serious problem in long-term care facilities, what can be done to help? Long-term care facilities can help ensure the safety of patients from the harms associated with inappropriate antibiotic use and thereby slow the progression and spread of antibiotic resistance by implementing an antibiotic stewardship program. Antibiotic stewardship refers to a set of commitments and actions designed to optimize the treatment of infections while reducing the adverse events associated with antibiotic use. There's a growing body of evidence supporting the use of a formal stewardship program to decrease unnecessary exposure to antibiotics, improve infection cure rates, reduce adverse drug reactions, and slow the emergence of antibiotic resistance. And all of this results in significant cost savings for the healthcare facilities. The CDC recommends that all nursing homes take steps to improve antibiotic prescribing practices and reduce inappropriate use. The core elements of antibiotic stewardship for nursing homes is a set of practical ways to initiate and expand antibiotic stewardship activities in nursing homes. Nursing homes are encouraged to work in a progressive manner, implementing 1 or 2 activities to start and gradually adding new strategies from each element over time. Any action taken to improve antibiotic use is expected to reduce adverse events, prevent the emergence of resistance, and lead to better outcomes for residents in this setting. Let's review each of the core elements and learn more about what kinds of changes may take place in the facility in order to drive down antibiotic use. Antibiotic resistance is a complex issue, and there is no single way to tackle the problem. Many different strategies need to take place, and many different people within a long-term care facility play a role. A good stewardship program begins with solid commitment from healthcare facility leadership. Owners and administrators can show their support by doing things such as the following. Write statements in support of improving antibiotic use to be shared with staff, residents, and families. Include stewardship-related duties in position descriptions for the medical director, clinical nurse leads, and consultant pharmacists in the facility. Communicate with nursing staff and prescribing clinicians the facility's expectations about use of antibiotics and the monitoring and enforcement of stewardship policies, and create a culture of antibiotic stewardship throughout the facility through messaging, education, and celebrating improvements, all of which promote appropriate use of antibiotics. Accountability refers to the nursing home identifying individuals who will be accountable for leading the stewardship efforts and who have the support of facility leadership. This may include empowering the medical director to set standards for antibiotic prescribing practices. The medical director should review antibiotic use data and ensure that best practices are followed in the medical care of residents in the facility. Empowering the director of nursing to set the practice standards for assessing, monitoring, and communicating changes in a resident's condition by frontline nursing staff. Nurses and nurse aides play a key role in the decision-making process for starting an antibiotic. The knowledge, perceptions, and attitudes among nursing staff about the role of antibiotics in the care of residents can significantly influence how information is communicated to clinicians who are deciding whether to initiate antibiotic therapy. And engaging the consultant pharmacist in supporting antibiotic stewardship oversight through quality assurance activities such as medication regimen review and reporting of antibiotic use data. The next core element is regarding drug expertise when it comes to using antibiotics. Nursing homes are encouraged to leverage healthcare professionals with antibiotic expertise when planning and implementing antibiotic stewardship activities. Support from infectious disease consultants and consultant pharmacists with training in antibiotic stewardship can help a nursing home reduce antibiotic use and experience lower rates of positive C. difficile tests. Some of the ways nursing homes can establish antibiotic expertise include working with a consultant pharmacist who has specialized training in infectious diseases or antibiotic stewardship, partnering with antibiotic stewardship leads at hospitals within your referral network, and developing relationships with infectious disease consultants in your community interested in supporting stewardship efforts. Making these kinds of changes at the pharmacy level can have a positive impact on reducing antibiotic resistance. Nursing homes should implement policies and change practices to improve antibiotic use. These policies should be phased in over time to avoid the staff becoming overwhelmed with multiple changes all at once. Some examples of policy and practice changes may include policies to support optimal antibiotic use, ensuring that current medication safety policies address Centers for Medicare and Medicaid Services regulations, Establish standardized practices for antibiotic use during the care of any resident with a suspected infection or who has been started on an antibiotic. This may include improving the evaluation and communication of clinical signs and symptoms when a resident is first suspected of having an infection, optimizing the use of diagnostic testing, and implementing an antibiotic review process. Pharmacy interventions can include integrating the dispensing and the consultant pharmacist into the clinical care team as key partners to support stewardship or making changes in the way antibiotics are prescribed within the facility. And identify clinical situations which may be driving inappropriate courses of antibiotics and implement specific interventions to improve use. The core element of tracking and reporting antibiotic use and outcomes is a data-driven element to help long-term care facilities guide practice changes and track the impact of new interventions. This allows the facility to maintain awareness about the progress being made in antibiotic stewardship. Activities in this element can include tracking how and why antibiotics are prescribed, tracking how often and how many antibiotics are prescribed, as well as tracking any adverse outcomes and costs from antibiotics. And finally, the last core element is education. Education is a key component to any antibiotic stewardship program and should be multifaceted to include appropriate messaging for clinicians, nursing staff, residents, and their families. Each target audience must understand their role in the process of stewardship to ensure its implementation. The information provided about the core elements are examples only, and you can check with your facility administrators for more specific activities that you may notice in the future. You can learn more about antibiotic stewardship by visiting the Centers for Disease Control and Prevention webpage for the core elements of antibiotic stewardship for nursing homes and their Be Antibiotics Aware campaign page. You can also visit the websites for quality improvement organizations and the Center for Medicare and Medicaid Services.